Hi, James Wu from the Endocrine Center. Wanted to talk to you about a question that we get all the time, which is, what does the incision look like after thyroid or parathyroid surgery? So today we're going to show you a few things. Number one, I want to tell you how we think about incisions, how we plan to make them, how long they are, where do they go. And lastly, I want to show you some examples of thyroid surgery scars, just so you have an idea of what they look like over time. So first, about how we think about incisions. We want to make them as natural as possible. We want them to blend into the creases of the neck. We want them to blend into wrinkles later on in life. And so we try to make these cuts horizontal or across the neck. If there is already a skin crease or wrinkle that's around the area of the thyroid, we will put it there. The thyroid lives right here, 1 or 2 fingers above this little notch in the breastbone or the sternum. And so most incisions will be in this region. When we make this incision, we try to keep it small enough so that we can safely get the work done. For a parathyroid surgery, that's about 3 centimeters or about a little over an inch. For thyroid surgeries, it needs to be as large enough to remove half of the thyroid, because we take out the thyroid 1/2 at a time. So for normal size thyroids, 3-4 centimeters, the incision will be about that size, about an inch to 1.5 inches long. If it's a larger goiter, which is our word for big thyroids, it may need to be a little bit longer for us to remove the thyroid safely. Here are some examples of what scars may look like after thyroid or parathyroid surgery. Here are some that are early on after the surgery. You can see that there may be a little bit of swelling, a little ridge there, and there's 2 reasons for that. One is because after the surgery, we put a little suture underneath the skin to help hold the skin edges together while it's healing that dissolves on its own. But that suture takes about 6 to 8 weeks to dissolve, so for the first 2 months after surgery, you will see and feel that little bump there, which will naturally soften and go away as that suture dissolves. And B, after surgery, your body goes through an inflammatory reaction. It draws in a lot of fluid and makes the area swell. That goes away bit by bit over time and helps the skin go back to normal. As you can see here, there's a few more examples of scars that have been there for a little bit longer. And you can notice that they blend in much more naturally. They are skin toned, they're not raised. But if you look closely enough, you'll know that people have had surgery, because some patients ask me, do they go away? And unfortunately, the answer is no, and that's why we try to make these as unnoticeable as possible, because we know they're going to stay. For other information about how you can treat an existing scar to make it look better or to minimize its appearance, we have some great videos about management and scar massage from my colleague, Dr. Masha Livitz. That's on our YouTube channel and website. And you can also look at our website for more pictures of patients' scars and get an idea of what it looks like. Again, I'm James Wu with the Endocrine Center. Thanks for watching.